So there is a young female, sudden, we are having the young female, and this young female is coming with the sudden painless, young female with the sudden painless loss of vision, and we also have a RAPD present. Now if I am saying RAPD present, that means we will have some problem with the optic nerve. We are actually thinking about the optic nerve disease, and the other eye is normal, and I think some people also said that rest of the examination is normal. We are not having any other thing. Please check the language of this question, because this was a long clinical question, so I have a lot of doubt about the language of this question, and accordingly we will decide that which test we should do. Yeah, so I think this was a multiple choice question. What were the options? Like 1 and 2, 1, 2, 3, 1, 2, 3, and 4, something like this. What are the options that we are having? So obviously this is for sure. It is for sure, because if you are having a sudden painless loss of vision and RAPD is present, RAPD is actually the earliest manifestation. This is the earliest manifestation of the optic nerve disease. It is the earliest manifestation of the optic nerve disease. So definitely I am thinking on the lines of the optic neuritis. So definitely I am thinking on the lines of the optic neuritis. And if I am thinking on the lines of optic neuritis, definitely I will do MRI orbit and brain. Now, I had a lot of discussion with the other faculties also regarding this. So, why we should do the anti-NMO and the MOG antibodies? So, basically, this NMO antibodies are also called as the anti-aquaporin antibody. All of the above was also present, na? Yeah. So, these antibodies are also called as, please write it, anti-aquaporin 4 antibodies, and these are actually there in the neuromyelitis optica. And what happens, these antibodies are definitely related with the optic neuritis. We have got two things. One is this anti-aquaporin 4 antibody, which is involved in the neuromyelitis optica, demyelinating disorder hai. Dusra hai MOG, that is your myelin oligodendrocyte glycoprotein. So this protein is also involved in the multiple sclerosis. This MOG glycoprotein is also involved in the multiple sclerosis. And we know that multiple sclerosis is the most common cause of the optic neuritis. This is the most common cause of the optic neuritis. So we have to do these two also, anti-NMO as well as MOG antibodies also. Now what do you think? Should we do thyroid profile? So we were having a discussion about the thyroid profile. Actually, thyroid can also lead to the compressive optic neuropathy, right? And if you see that there is a common dictum, I found out all the tests that you should do in the patient of the optic neuritis. Basically, optic neuritis is a diagnosis of the exclusion. So this is a very important piece of information which you should take down. So basically, optic neuritis is a diagnosis of exclusion. So before making a diagnosis of optic neuritis, you have to rule out certain things. So in order to rule out those certain things, you have to do certain tests. So number one is the ESR. And you will be surprised to know that second May they have given the thyroid function test. Thyroid function test. So you have to actually do the thyroid function test also in order to make a diagnosis of optic neuritis, because we have to rule out. It's a diagnosis of exclusion. Then we have to do the anti-nuclear antibodies we have to do. Then we have the angiotensin converting enzyme. angiotensin converting enzyme, this we have to do. Rapid plasma reagent test, that we have to do, as well as the mitochondrial DNA mutation. So you have to do the thyroid function test also. What do you think about blood glucose? Will you do blood glucose for optic neuritis? 1 2 3 to ho gaya. So Dr. Stranger is saying that options were toxoplasmosis, posterior staphyloma, tuberous sclerosis, and pigment epitheliopathy, CMV retinitis. Among these 5 options, 4 were given and asked not seen in. Are you sure? Isme we were having posterior staphyloma and you said this, and you are saying toxoplasmosis. Then you are saying that we were having tuberous sclerosis. Tuberous sclerosis agar hai to it is a right one, because tuberous sclerosis will definitely show me, and CMV retinitis will not show me. So CMV retinitis I do not know. Pigment epitheliopathy can show. Pigment epitheliopathy. If they have given you these options and one was your posterior staphyloma, then posterior staphyloma will be the answer. Posterior staphyloma is not a punched out lesion. Toxoplasmosis में मिल जाएगा, pigment epitheliopathy में भी मिल जाएगा, tuberous sclerosis में भी मिल जाएगा. So then in that case the answer will be not seen in. तो अब क्या है इसमें देखो, what do you think about this blood glucose level? Blood glucose level करना चाहिए नहीं, उस पर भी मैंने बहुत सारा रिसर्च किया. And what they said is that basically ये था कि even HbA1c levels are found to be higher in the anterior ischemic optic neuropathy. तो अगर anterior ischemic optic neuropathy है and the patient is having the high levels of glucose, hyperglycemic index is high, then we are having the more poor prognosis of anterior ischemic neuropathy. And they have clearly mentioned the American Academy of Ophthalmology. American Academy of Ophthalmology clearly says that it is a biomarkers to determine the visual prognosis in the optic neuritis. So according to that, all the 4 options are correct. A, B, C, D, all the 4 options will be correct. They definitely you have to do MRI brain, you have to do the anti-NMO neuromyelitis optica है, या फिर this multiple sclerosis का MOG glycoprotein है, thyroid profile में they have said diagnosis of exclusion, and even the blood glucose level. So अगर 1 2 3 4 था options में, then you have to go with all 4 options. You have to do all the 4 options and the diagnosis of exclusion. बहुत डेप्थ में था. क्वेश्चन नंबर 6 का देखो, सडन पेनलेस लॉस ऑफ विजन था, उसके अलावा आरएपीडी था. विच टेस्ट टू डू, तो इसमें ऑल 4 ऑप्शंस करेक्ट हैं. प्लीज चेक द ऑप्शंस फर्स्ट एंड देन लेट मी नो. एंड आई हैव डन अ लॉट ऑफ रिसर्च एंड डिस्कशन, उसके बाद ही मैं उस पर पहुंची हूँ. फर्स्ट ऑफ ऑल आई वाज थिंकिंग कि व्हाई दे हैव गिवन 1 2 3 4 है ना, क्योंकि फर्स्ट उसमें एमआरआई एंड 1 and 2 लग रहा था. But if you look at this protocol, they clearly say that thyroid function tests have to be done to make a diagnosis of exclusion. So obviously you are going with this, and the sugar, blood glucose level is a potential marker for as a prognostic factor. So you can do that also. So all the 4 are correct. ठीक है.